Well, it is back to school next week for students all across Central Texas. From monkeypox to COVID to masks, we've been getting a lot of questions from parents when it comes to health concerns. So this morning, we're taking your questions straight to the experts. Dr. Kunz from Baylor Scott and White is making a house call this morning. Thanks for joining us here. First up, Dr. Kunz, we're getting a lot of questions from parents and caregivers about masks. Are there any circumstances where you would advise kids to wear masks at school?
There's a real high level of spread of COVID-19 in the community right now, and certainly there will likely be a lot of COVID going around schools too. So I think it's advisable for all children to wear masks in school right now.
All right, and I know that is, of course, a personal decision, right, for the parents and caregivers to decide, since we don't have those mask requirements. But let's move to testing now. How often should families be testing their kids for COVID?
When kids have symptoms of COVID-19, like sore throat or fever, runny nose, cough, headache, body aches, then it's a good idea for them to be tested for COVID-19. If kids don't have symptoms of COVID-19, then there's no need for them to be tested.
Okay, thank you, Dr. Kunz. Now, I know, of course, COVID isn't the only issue. There's now monkeypox concerns growing all across the world. What precautions should parents take for that?
Monkeypox is a disease that's spread from close skin-to-skin contact most of the time. So if a close family member or someone that the child is around has an unusual rash, a rash that looks like it has fluid-filled bumps or vesicles, then that's concerning. A family member should avoid touching that. Also, if that's touched bedding or clothing, they should avoid touching that as well. And then that person that has that symptom should definitely go be checked out by their physician.
Yeah, checked out and isolated until they get those test results back. With the monkeypox and COVID concerns in general, I guess my next question would be, should parents be holding back on any extracurriculars or play dates for their kids?
I think extracurricular activities and play dates are really important for kids. It's good for their emotional health and their physical well-being. I think if parents take precautions like having their kids vaccinated, and then if they're in large groups that are indoors wearing a mask, I think it's safe for kids to continue most activities like sports, going over to friends' houses, and those kinds of things. If there's a friend that's sick, with COVID-like symptoms, then of course they should avoid being around that person close up.
Yeah, especially over the last 2 years, I know the mental health of kids, of course, has been top of mind. If kids are contracting COVID-19, is there any guidance on how long they should be staying out of school?
If a child has COVID-19, then they should isolate at home for a full 5 days. If at the end of that 5 days they're feeling better, they don't have fever, their symptoms are significantly improving, then it's okay for them to return to school, but they definitely should mask up for a full 10 days from the beginning of their illness.
Okay, Dr. Kunz, thank you so much for all of your advice. We really do appreciate it. Dr. Kunz from Baylor Scott and White, we thank you for starting your day off here with us.
Thank you.